Yeah, firstly, welcome to this Centre for Care seminar. It's great to see some new attendees for our event, so particular welcome to you. For those that don't know, my name is Nathan Hughes. I'm a professor here at the University of Sheffield and Deputy Director of the Centre for Care. And for the benefits of those new attendees, or for those who don't know so much about us, the Centre for Care is a collaboration of 5 universities and 4 policy partners here in the UK, based with us here at the University of Sheffield, and it's funded by what's called the Economic and Social Research Council, so one of the key sort of government-sponsored funding councils in the UK. And our research explores all aspects of care and caring, from kind of formal services of social care through the kind of family care that we're going to be talking about today, as well as the kind of the wider sort of policy and system context in which care is governed by. And this seminar is part of a regular series where we invite external experts and colleagues at the centre to present their work. I've already given apologies to Jagriti that today's attendance is impacted by school holidays here, so there might not be as many of us as usual, but be reassured that these seminars are recorded, and so they'll be watched by a wider audience that might be here today. But I'm delighted to welcome Jagriti Gangopadhyay to give our seminar today. So Jagriti is an assistant professor at the Manipal Centre for Humanities at the Manipal Academy of Higher Education, where she's also the coordinator of their sort of Centre for Women's Studies. She's going to talk to us today about her research into new forms of later life family care emerging in India. Jagriti is also a recent addition as associate to the Centre for Care, and she's very keen, I think, to think about how we can connect our research centres together. So particularly for colleagues here from the centre, please have this firmly in mind as you listen to her talk. So Jagriti's going to talk for about 30-35 minutes, and there'll be plenty of time for questions after that. So I'll hand over to Jagriti to try and get the technology working.
Okay. Thank you so much. Am I audible?
You are, yeah, perfectly.
Yeah, okay, thank you. Thank you, Nathan, for that very kind introduction. And I want to thank everybody at the Centre for Care, particularly Dan, for coordinating this, Dr. Davish for organizing everything. It's a very big opportunity for me, so I'm very thankful and grateful. I'll begin by talking about a little bit about my background and also where I work. I did a PhD on aging and intergenerational relationships in multi-generational family settings in India, and also in family settings in Canada, though I did not find much multi-generational families in Canada. Nonetheless, it was like a comparison of different aging experiences and the role of culture in how aging is shaped. In both contexts, I interviewed older Indians, one of course in India, they were older Indians, and in Canada, I interviewed older Indians who immigrated when they were in their 30s, but have grown old. They're like when I interviewed them, they were 65 to 70. That was the age group. Following that, I've also done a short postdoc in Bhutan, where again I studied the role of belongingness and attachment to land, and specifically the role of religion because in Bhutan, religion plays a very crucial role in later life experiences. That was funded by Kyoto University, so I was there. I'm currently working at Manipal Centre for Humanities, which is a Centre of Excellence. It's a teaching and research institute, and it is a place where new emerging research is given much voice, with specific focus on qualitative research. My area is primarily on later life care. However, I have my own PhD students. They're working on health and well-being of medical students, then the different care forms of care that are rising for child-free adults, which are also rising in India, then child care for mothers and STEM. So I work on different aspects of care in that sense, and this is my cohort, but there are also my colleague, Dr. Ketaki Chaukhani. She's also looking at the perspective of care for single adults, like couples, adults particularly are not choosing to get married. My other colleague, Dr. Gayatri Prabhu, she's also in the area of medical humanities, and been exploring autoethnographic accounts in a hospital setting, the role of institutions. So there's a large conversation that we do have on medical sociology, medical humanities, and these courses are also taught there, and so as you can see that, and we are now my current research, and that is what I'm interested in looking at. I'm looking at digital care, which has really been on the rise in the post-pandemic India. So this is the place from where I come from, and a lot of my work that I'm going to be presenting today. This is the new research that I'm doing because India is experiencing non-traditional forms of care, and that's what, of course, the examples are all from later life care. However, now there's a major shift and change, and I will be talking about how I have myself moving away from the research I did during my PhD with the changes I myself see now, and the kinds of care that are coming up, and how the role of the pandemic is crucial. So I'll begin with like that's what this presentation is about. Just share my slides. Okay, I hope everybody can see the slides. So before I begin the presentation, I'd like to give a little bit more context of the aging population in India. Since we know that last year India actually, I think this year, India topped the most populated country list globally. But one of the challenges that India faces is it's seen as a very young demographic country. Like demographically, the focus in terms of policies is very youth driven. However, we are still waiting for the current census, which was supposed to be out in 2021, but it has been delayed. But as per the 2011 census, 8% of India's population is actually the older population, the elderly population, and that population is consistently rising. And now there is also different categories in terms of older adults, then oldest old, and older adults in that sense. However, the policy in that sense for the old population is that later life care primarily rests on family, and though the description of family is quite broad in terms of the legal framework, like it includes adult children, like adult sons and daughters, daughter-in-laws, stepchildren, adopted children, children born through surrogacy and IVF. Nonetheless, if you look at the research that is done in India, primarily it shows that it focuses that adult sons and their daughter-in-laws, and primarily the older adult son, continues to take care of his older parents. That's like the dominant form of care that you will see in India. So, and there is like lots and lots of studies. In fact, my own studies, my own PhD, when I did my PhD, most of the multi-generational families that I interviewed in India, everybody primarily lived with their adult son and their daughter-in-law and their grandchildren in one building, or definitely together, like cohabitation. And this is the general norm in urban and in rural areas across the country. So, and there's a lot of research in which it shows that sometimes when it becomes like elder abuse, there's research on abuse of older adults or abandonment in older adults. Primarily, the blame goes on adult sons in that sense, or their wives, spouses, essentially, as to how they have been mistreated. And so, the large narrative is around that. So, however, now there is a shift gradually, and that is more in the urban areas. And there is now a new form of care that is rising, that is privatized and paid caregiving. This is, of course, so I also, sorry, I should have added this at the beginning. I'm primarily, my work is very much situated in the urban context of India, not so much into rural India in that sense. You might see that all the examples of the scholarship also that I draw from, it's very much in line with what urban scholars have written about. So the other form that is really rising now is in India is institutional care, also known as old age homes. It's actually more popularly known as old age homes, which is not so much of a choice for many older adults. However, nonetheless, now there is like people are choosing to move into old age homes because you'll be cared for and you'll be taken care of. And there are the private old age homes which are quite expensive. If one can afford it, then mostly adult children are also willing to pay, and parents move in there. In fact, the aging population of India is also sort of divided. It's not like universal across the country. So states such as West Bengal and Kerala, they have like the higher percentage of older population. So recently, this is why I bring this up. West Bengal just introduced in a township for older adults, which is like quite on the suburbs of Kolkata, the city, the main city, and they have a dedicated park for senior citizens and a very big institutional care home for senior citizens. They have activities for senior citizens. Of course, it's quite expensive and primarily NRI children, they keep their parents, older parents over there. Nonetheless, this is how like private and paid caregiving is a major change that is coming, like a shift from family to reliance on hiring of trained nurses. So the other common thing that is happening is private hospitals are now providing private paid trained paid caregivers in the form of nurses who will look after older parents, primarily in the age group of 80 to 90, because now there's a huge surge there's not much statistics available, but in terms of longevity, now India's population is really, increasing in that sense. So, which is why paid caregiving has now become you will see like I by recent study which I'm still doing, I asked this question about living with the CCTV cameras, so the surveillance mode in that direction. So the common themes that many of the older adults actually told me was that how uncomfortable they are, that they're constantly being monitored by their children for their activities and like about their mobility, or they're constantly being watched, and the discomfort that the presence of a camera creates. But nonetheless, this is a very common arrangement now that we see in among the middle class and upper middle class households of India, in the sense that because of the restructuring of the joint family system and not too many adult children residing in the same city, or even in the same country in that sense. So that is why there is a major shift in privatized and paid caregiving, like from the family care. So this is just to give a little bit of background and backdrop of the care, later life care scene in India. Also, just to add that because primarily there was much focus on adult sons and daughter-in-laws looking after their parents, ensure that there's some awareness that India has a huge son preference, in the country. Like sons are, of course, preferred over daughters, because daughters are often like they would get married and shift to another, like they would shift from their natal household to the household of their husband and in-laws. So it's the responsibility of the daughter to look after the in-laws and not her own parents. So which is why India did also have, and still it still has a huge son preference across the country in that sense. So, however, my current research, because it's on non-traditional, I have deliberately tried, because there is kind of some scholarship on paid caregivers and family care. Within family care, I'm looking at the other forms of alternate cares that have emerged but have not received much attention in scholarship. This is my mother with my son. So the reason why I am giving this personal context is, so this is where I'm going to be coming from. So my focus is primarily on adult daughters, and this time because I myself am an older adult daughter, and so my brother lives in Canada and cannot come to the country. He's working in Canada lives there with his family. He visits us, once in 3 to 4 years. However, I have to make trips at home every 4 years. My parents also come and visit me, because Manipal is also essentially known for its medical facilities, like very good, affordable medical care. And it's part of our system also, where, we get hospital facilities at much affordable rates, not just for us, but also for our family members. So when my parents come to visit me, we have a regular checkup and everything. But primarily what I'm trying to say is, I have emerged, like despite having a son, I as the older daughter have emerged as the primary caregiver. So my research stems from this argument, and this essentially happened because during the pandemic, what happened was that many older adults were stuck in the high rises of across India, and the high rises had really, really strict surveillance rules and regulations. So like all delivery was stopped and no communication, like even like though I was stuck in the same city like my parents, but like because my parents lived in a high rise, I was not allowed to meet them, not go inside. So that really became a challenge, right? To meet them or to do anything for them, even to like provide medicines for your parents, or even because, in like most of India is also suffering from many chronic illnesses like primary diabetes and high blood sugar. But we couldn't do anything, and there was a shortage of supply because the first lockdown, we really were unprepared. Like we would just like this country just went into lockdown without any preparation, and we didn't know that it would go on for such a long time, and we were all stuck in different parts. And one major change that happened was, of course, the rise of digital care. Then we could only talk to our parents, etc., through smartphones. And there is some research, there's a lot of research that's happening in terms of so I'm sure I also saw the Taylor Foster, Dr. Taina Haleen, her work is on how nurses in different parts of the globe actually have transnational calling and take care of their older parents via phone calls and smartphones. So while that emerged, however, nonetheless, increasingly now, there's of course no statistics to prove this, but I started my interviews and I interviewed a lot of older adult daughters who have now emerged as primary caregivers for their older parents. And one major change that is now happening after the pandemic is that a lot of older parents are now choosing to shift near the oldest adult daughter who can be primary caregiver. And this is a very, very common living arrangement. Of course, they cannot co-reside with their adult daughter because of complications with the in-laws. However, they're choosing, like they're buying apartments very, very close to the adult daughter's household, primarily so that they can be looked after by the adult daughter. Now, so this is a short study that I did, and wanted to share some findings from that study. One of the key findings that did emerge, this was of course done in again. So I myself am from West Bengal, and I can speak the local language there. And I did some part. The other interviews were done in Manipal because in Manipal I also live in a major high rise, and because I have interacted with a lot of older parents who have told me that they all like they are neighbors to their adult daughters. So they have shifted, they relocated to Manipal because of the towns like medical facilities, etc. And it's much easier for them to do it here. So there was a major shift. It's mostly very common if they have two daughters. Like it's very common for older parents to shift near the older daughter's house if there are two daughters. However, even if there is one son and one daughter, now there is much increase in like expectation that daughters will do more for their parents as opposed to sons. So if you notice that I put in the scholarship there, but primarily usually it is shown that daughters were only able to provide emotional support so far. Like the primary physical support or financial support was expected to be provided by adult sons, and daughter-in-laws were the most primary caregiver. However, now there is this major shift, and many a times most adult older daughters are actually not just providing emotional care, of course, but also physical care. And they keep one key of the household so that in case of a night emergency, they can just enter the house of their parents, and like what has to be done has to be done. So this is not just in terms of a shift in the care arrangement, but also in the living arrangement. Like a lot of like a shift is happening so that parents can now move in or move very near to their daughters' households to be looked after. Having said that, there's also a major change in that sense with regards to the property law. So for a very, very long time, daughters were not allowed to inherit ancestral property. Property could be inherited, like sons could, specifically married daughters. It was difficult for married daughters to inherit property in India, but now there's a shift in the property transferring laws also, and married daughters can also inherit property. So because, like there was also this understanding that even if daughters do provide care support with later life care because property could be shifted only to sons. So there was this major conflict that would happen within the family setting because daughters wouldn't have any inheritance in that sense. But now that the law has changed significantly, there's a lot of caregiving that is coming up from daughters themselves. So I also interviewed some of the daughters, and they said that while I primarily interviewed the older daughter because that's how the living arrangement was, most of the older daughters said that while they are the primary caregivers, but they're very much in touch with their younger sister, who is providing emotional support, or the brother there, in the sense that yes, who is there and who is providing support emotionally or sometimes financially or is in the loop. But primarily the older daughter has emerged, and they are very happy that this shift has happened in India, which they believe was much needed. However, one interesting finding that I did find, and I have to share that. So when I interviewed the older daughters who had younger brothers or older, sometimes the daughters were also younger and the brother was older, like that the daughter is the primary caregiver. So there was some conflict. Like they felt that while India has this, huge son preference, and which is now changing and shifting, nonetheless, they did blame the sons as opposed to they should be doing it. Like traditionally, that is how it is done, but now there is this major shift. So they were not very happy with the role the brothers played. However, if they had a younger sister, they didn't blame the sister, and that was essentially because there was traditionally no expectation from daughters. So there was this very different aspect, that interesting aspect that came out, that there is some blame when they had a brother as opposed to when they did not have a brother. So that sibling relationship also I thought was quite interesting as to who does more, because one thing that most of the sisters said that that men change after they get a wife, etc., but we haven't changed. So there was this brother sister conflict, which I did, which I did get to know when I was doing my interviews. However, in most cases, the older adults did also have like a paid caregiver, often living with them, who would be 24/7 and who would be doing the grocery, the shopping, and like other needs. However, the daughters would visit them every day, and make a note of whatever they needed, whatever they required, take them to the doctor. So there is this combination of family care with the paid caregiver, because most of the older daughters were also working. They had their own jobs, and they had their families, children to look after. So nonetheless, so there is this shifting of responsibility, but this is a very major shift that's happening, that a combination of which is why I titled the non-traditional forms, because these are major shifts from the traditional images of care that India has had for so long. Having said that, is the other part of my research, which is again I'm doing, on a parallel note. So, because in India there's this huge gender ratio within the family setting, which one cannot really ignore. So, in most cases, what happens is that the older female spouse, often older female adults, is providing later life care to the older male adult, and otherwise, mostly, even if there is a paid caregiver, there mostly she is like doing everything, like at night taking him to the washroom, and she's the primary caregiver in that sense. And there's much expectation from older female spouses in that sense also to provide care. So there's this very interesting study by Tanishka Samantha in India, who actually, in that sense, on changing later life care in couples. And there was this something that they found, that often men are more interested in getting married, even, like after the loss of a spouse, as opposed to women, older women who choose to have living relationships, because they don't want to be the primary caregiver of another man. Because there's this expectation that women have to provide care, in, specifically in the South Asian context. So now, however, again in the urban context, and this is the primarily among older female adults with terminal illnesses, with whom so someone I again noticed this in my own family, and that is why I started doing research around again in the city of Kolkata, where I'm based. And I found that now there's a major shift in the sense that a lot of older males are actually willingly providing little life care to their own spouses, of course with the help of a trained paid caregiver, but nonetheless doing everything, like even sleeping with the spouse while holding like emotionally being there for the spouse, physically doing everything, taking the spouse to the doctor whenever needed, or during COVID vaccines, like ensuring that the spouse received the COVID vaccination and monitoring their health, to their diet, to like to ensure that the physician also visits, all of these coordinations. So again, there's a major rise and shift in the care that male spouses themselves are willing to provide. So again, this is like a like direct contradiction to the gender practices that we see in Indian households, across India. So these are the two forms of research that I am conducting at this point. And one of the key things in this male spouses, I of course could not interview any of the older female spouses. And when I asked that, like what in that sense moved them to provide care, because that the Indian male within the family setting has a very traditional role of being looked after. So then what led to this change? So they did not actually have like a proper answer, and they just believe that it's sort of it was like more like they should be there for their spouse, and like they should be looked after, and they believe that it was more their duty, and it's a relationship which they had with their spouse. And again, in very urban spaces nonetheless, but this is a major shift. So when I was in Canada, this is something that came up, in my interviews in Canada, where most of the older female adults told me that they receive care from their male spouses, essentially because they said that in Canada you're trained, you have to be looked after, and we both care for each other. However, in contrast, in India, the answers were more like the women never receive care. Women often also do not share their health status much in the family because there is no expectation of care. But now there is this major change. Of course, as I said, this is a very specific group, like older female adults with terminal illness, and I am yet to notice if this is like more like a general trend. However, there is this major shift which is happening, where the male spouses have taken much responsibility with respect to providing care for to their spouses. So this was the end of the slides, and I just wanted to add that most of these are not captured at the level of policy and in the legal framework, which largely just expects that older adults would be looked after by their spouses. But like now there is different forms of family settings which are arising in India, like young adults who are choosing not to get married, or also child-free adults. And there is a major shift in the family structures and setting in the Indian context. And having said that, it is important to note that how this living arrangements, changing of family structure, would give rise to different forms of care in that sense. Thank you.
Thank you, Jagriti. That was great. Really interesting really interesting change that connects, whilst about India, connects to a whole load of the concerns that we would have around kind of gender and intergenerational care and so on. I'm sure it will provoke